Somehow, in getting you in now, have managed to lose the um, sound through my earphones. So I'm just trying to go and get those back on again. I don't know what's
It's all working fine. And then you
Feels
connect me.
better now.
Ah,
Yeah.
we're back. We're back. Yeah, cool. All right. So I was just explaining how when you're trying to get pregnant, you need to keep this pelvic region as soft as possible. Because if it's like a pillow and it's nice and soft, then essentially when the baby comes in to nestle in, it's got something to nestle into as opposed to a stiff board-like structure. And so we work with some mental ways of relaxing the pelvic region, but we also work with some physical ways so that you can just release that tension because, it's not all about emotional tension. Our bodies are rigid sometimes, and that's what we need to loosen up. Now, this is where you come in because you are absolutely the expert on this. So I wondered if you could talk a little bit about how to identify what it is that you would need to do in your own body and also some of the nerve pain issues as well that might come up for people.
Oh yeah, for sure. I think the biggest thing is having some sort of baseline or some sort of starting point. And what I usually teach is kind of identifying maybe two or three things that you can use to tell if your body is in a more guarded state where things are tighter, maybe muscles don't feel like they're engaging properly, maybe you even feel a little bit out of balance or even feel like you're out of alignment, versus when you're in a more or less guarded state and muscles are engaging properly, they're feeling looser. So you need a way to tell. So I'll have my clients kind of identify maybe two or three things that stand out that maybe feel a little bit uncomfortable or tight, and they use those as their baselines. That way they can see what exercises make those things better, or what exercises makes those things worse. And maybe some simple ones that you can test are bring your knee up towards your chest. Does that feel like it pinches? Is that uncomfortable at all? Or maybe even bending forward, like you're going to bend down to touch the floor. How does that feel? Is there any areas that feel tight, tender, sensitive, maybe more on one side than the other? Even doing a body weight squat, you can use that and see, does anything feel asymmetrical, or does anything feel a little bit uncomfortable when I do that? And then these things can become the baseline that you use in getting a before and after effect of certain hip openers, certain lower back exercises, because your body will give you pretty fast feedback, and it might be subtle. So you have to do these movement tests in order to assess it. Your body will give you pretty fast feedback on if it's something that maybe is resonating with you versus something that is maybe working against you.
And it could be, I'm assuming, something that could be on your left side but not your right side, because none of us are equal. I mean, you just look at your face, and not your face, but you look at people's face, it's never equal one side to the other. And we're just built like that naturally. We have different
Right, yeah.
organs on different sides. If women have complications with fertility, for instance, if it's PCOS, they might have more follicles on one side but not the other. Same in endo, it can be wrapped around different areas. So if you do it, you're looking at each different side, not just is it generally okay, going into the detail of it. Yeah.
What I'm kind of understanding is you're saying if like they have, maybe it's more affected on one side, there may be differences on that side. Like if the okay,
Yeah.
yeah, I generally tell people to look for relevant asymmetry. So what that means is, like, we have some differences. Maybe you can't stretch as far on one hip than the other, but it may not be really relevant to discomfort or anything that you're feeling. You just may feel a little bit tighter on that side. That's not always as important as finding things that are more relevant in terms of that cause, maybe more discomfort or maybe feel tighter than usual. But looking for more of those relevant asymmetries, which is, yes, sometimes we do have relevant asymmetries or irrelevant asymmetries here and there.
Okay. So once I've identified, for instance, that my right hip is tight, this area around this pelvic girdle, what do I do then if I were your client?
If you were my client, well, I always start with lower back stretches first, just to, that's the core of the body. So we always want to make sure that there's nothing going on up there that can be affecting the hip. Because if
Hmm.
your lower back or your lower lumbar spine is sensitive, that can cause muscles in the hip to feel tight, to guard. So I'd
Like
start with doing
compensating.
right, yeah.
Yeah.
So I would start with something as simple as doing a cobra. So trying out a cobra stretch, which is fully extending your spine and then
Mhm.
monitoring how your body feels with that. Of course, if you're doing an exercise, you never want it to be getting more uncomfortable the more you do. And if it is at all a little bit uncomfortable, you want to make sure that it's a low kind of tolerable level, and you only want to continue doing something that is potentially slightly uncomfortable if it makes you feel better afterwards. So if
So,
there's no positive after effect, then it may not be worth doing. You may want to test other things.
so
But
in
I would
terms
start
of
with cobras. Yeah,
yeah, so in terms of spotting good and bad
yeah,
pain, um, I'm assuming good pain is where you feel discomfort and maybe a tightness that you can feel instinctively is releasing, and a
right.
bad pain is more of that grinding sharp.
Exactly. So maybe a tolerable or good pain or something that you can work through is
Hmm.
usually getting easier to do with more
Hmm.
repetition, feels like it's releasing. That might not always happen on the first set. So if something is consistent through maybe you doing a set of 10, what you would want to do in that case is check your baselines again. So those things that we talked about, does doing that exercise kind of release your body out of that more guarded state that makes the squat or the bend forward or the knee to chest, whatever your baseline markers was, does it make those any better? And if it does, then although maybe it felt a little bit of a, you felt a little bit of a maybe consistent mild discomfort, it was helping other things. Now we would consider that a good pain, and it should be easier on your second set.
Yeah.
And then, like Karen said, it shouldn't be anything that's sharp and shouldn't be anything that's progressively increasing the more you do. And you want to test two things. You always want to see how you feel during, and you want to see how you feel afterwards in terms of your movements. Are you loosening up at all? Is anything becoming more relaxed? And that's kind of your marker on if your body's in a more or a less guarded state. And of course, you want your body to be in a less guarded state for fertility.
So let's assume I've done the cobra, which is where I'm lying flat on my stomach and I'm lifting myself up to my elbows, is it? And bending my spine back.
Yeah.
How long do I hold it before I go back down again? And then I'm assuming I'm repeating that 10 times.
Yeah. So that is a variable that you can experiment with. So what I usually do with my clients in the beginning is we just go 2 to 3 seconds with the goal of getting to the end of the range of motion
Hmm.
and then releasing and kind of working into that end range, because magic tends to happen when you work the full range of motion. Because a lot of times, if your body is kind of, and there's some theories about this, but if your body is in a more guarded state and you're doing something that it's perceiving as challenging, which maybe is full spine extension, but is not causing pain, then stimulating those joints and those mechanoreceptors can cause your body to release kind of more globally. But yeah, so anyway, 2 to 3 seconds is what I would start with. However, you can play with the variables. So some people feel better when they sustain and they hold that for 10, 20 seconds. So it's just a variable you can play with. I've even had some people that I just had them kind of stay in that propped position and stay in there for 20, 30 minutes. And it really depends on the what they're experiencing and what the body's response is. The
Okay,
rule of thumb, start something slow.
and then build up from there.
You may not need to build up. So it
Ah,
depends on
okay.
if let's say, for example, not everybody will respond to doing a cobra stretch, but let's say if that was your exercise, like moving your spine into that position for whatever reason, maybe you sit all day and your spine is kind of hunched forward and it really likes to be extended. So let's say that's your exercise. You may only need to do 10 reps with a 2 or 3 second hold until those other baselines, like the bending forward, the squatting, the knee to chest, until those things feel better because your body's tension has released. So you may not need to hold them longer. It's all about finding what your body needs. For some people, maybe it's 2 to 3 seconds. Some people, maybe it's a little bit longer. And for some people, maybe it's a completely different exercise. Like maybe instead of cobras, your body will respond better to kind of like a prayer stretch or a child's pose, where you're in a more flexed spine position. And I'll usually test those before I move on to more hip specific. And the prayer stretch and child's pose are generally more helpful during pregnancy, just because of the more natural kind of curve that happens in the spine as the baby grows.
Hmm.
You start to kind of arch your lower back a little bit. So doing things as simple as stretches that flex you forward can really go a long way.
And use props at that point, depending how big you are, I'm assuming.
Yes, yeah,
Yeah.
yeah. Depending on what trimester you're in.
Yeah. So that's really interesting that we're talking about the pelvic region, but actually what we're doing is talking about the back, because it is the core. It's, this is your core area. But actually, when you think about where your central nervous system runs down your spine, the messages for fertility run from, your head all the way down your spine to your reproductive area. So if you have tightness there, whether that be from endometrial scarring or any other inflammation perhaps that's going on, that's preventing this nerve message from getting from your spine to your reproductive area, at that point you're really going to struggle to get pregnant. So it's really interesting that you naturally just tie that all in and say you need to release the back first before you start with anything else.
Yes, I always start there. Kind of like you said, everything that goes to the hips comes through the spine and the lower back, or the even higher up in the spine. So always start there first, thoroughly test those, because I've seen so many people, and there have even been studies done that have shown that finding the right way to release your lower back also helps your hips. And contrary to that, if you do need to release your hips, but also need to release your lower back, if you're just focusing on your hip, then you're not going to get anywhere. You're going to feel like you're going in circles. So you at least need to find the back exercise first, then find the hip exercise.
And how about strengthening your back once you've stretched it out? Because I'm assuming that if this is all tight, it's being held in the wrong place by muscles and tissues elsewhere. And so at that point, some muscles may well be looser because they've been stretched into the wrong position than would be ideal. Am I right in thinking that?
I'm just really sorry, Karen. I think I froze for a second. But what I heard you kind of ask about during that was, I think you were asking about strengthening kind of after maybe you release that tightness. Should you strengthen either the back or even the hip? Was that the question?
That was it, yeah.
Okay, perfect. Yes and no. So yes, because if you do strengthening exercises, it adds kind of a layer of stability or resilience or sense of strength in the body, and that in turn makes you more able to tolerate different physical stress because your body feels stronger, feels more resilient. No, in the sense where it's not always a weakness issue. So when you have muscles that guard and that kind of tighten up, you can think about a muscle as like there's these long bands that run parallel to each other, and there's sections of them. And so when they tighten up, a section of that maybe gets stuck like this. And so then you have less of the muscle that you can use, so you feel weaker. And you have less of the muscle that you can stretch, so you feel tighter. If you find what your body or your nervous system needs, which is basically what your body needs, to release that, then you've got that muscle control and strength back again. So not everybody is weak, as is often kind of perceived by kind of our traditional approach. It's usually once you find those things that release your body, you feel stronger again. And that's why that before and after test is so important. Because if you find, let's say, maybe it feels a little bit more challenging to do a squat on, or even a sit to stand on the side that feels more effective than the other side, usually it will feel better and you'll feel stronger and more stable after just finding the right way to move your body. And so strengthening, although is good, it's not always necessary in the way that people think. Usually you are strong, you're just not getting the same control of the muscles that you did before things started to tense up.
That makes things a lot nicer and easier then. There's only
Right,
one job to do as apart from
Yeah, so the strength and stability stuff helps build that extra layer on top.
Mm-hmm. Okay, so we were talking about doing the cobra, which we've explained. You mentioned child's pose, which is where you lie down on your knees with your knees spread and your hands out, your forehead ideally to the floor, but perhaps on a cushion, depending on your mobility. The prayer pose.
It's I would say usually you don't have to get too particular on the exact way that you do it, but it's just something to flex the spine. So whether for you that's getting into a prayer stretch or kind of a child's pose position, or even laying on your back and bringing your knees towards your chest and kind of having, with you having that, if you are maybe in a stage of pregnancy, maybe the legs are a little bit wider out so they're not pushing in on the belly. But doing something like that, or sometimes even simply sitting down and stretching forward, something that flexes the spine.
So it's about feeling where you personally feel the release, because it's all individual.
Right. And maybe some positions may be harder for you to get in than others, or maybe having pressure on your knees might not feel comfortable for other reasons. So there are always ways you can adapt it. The goal in that particular case is to kind of flex and stretch out everything in the lower back in this kind of flex direction.
Yeah. Okay. So if we're talking then about, we talked about spine and the central nervous system. How do you work with the nerves and perhaps nerve pain as well when all of this is happening?
Well, there are a lot of there are a lot of different, like there's a nerve pain where a nerve is being pinched. There's kind of like, are you referring to more that type of pain?
Well, it's more like if someone's feeling pain and discomfort when they're doing this as opposed to stiffness.
Yeah.
How do you, at that point, recommend that they move forward with making sure that they can stretch adequately? Is it still go until you feel the pain and then 10 times, or so it's up
so that
until the pain and then stop?
That kind of goes back a little bit to when you're doing the exercise, it shouldn't feel sharp. It shouldn't feel like it's increasing. It should feel like, in the ideal, like if this is potentially an exercise for you, it should feel like it gets easier to do with more reps, whether that means you can go further into the motion before you feel any discomfort, or whether you feel less discomfort at that same point in the motion. It should feel like it's getting easier to do in that sense. Or if it is kind of a discomfort that you feel throughout, let's say 10 reps, it should make something else feel better afterwards, either your overall symptoms or those tests that we talked about, like whatever the test is for you, whether that's a squat or bringing your knee to your chest or bending forward, you should feel some difference. And if you're unsure, I would do a second set. Sometimes the second set feels easier than the first, and that's when you start noticing changes. But if you're doing 2 or 3 sets of an exercise, you feel about the same afterwards, nothing really changes in your range of motion, then that's probably I would continue checking other exercises and seeing if there's something that really resonates with your body, and kind of moving down a systematic list of things. That's, like I said, starting in the back and then going into hip stuff, hip openers and things like that. But generally, most people will have somewhat of a directional preference to how their body should stretch or needs to stretch to kind of release that guarding or that tension. And if you start by just simply like, well, does my body like my spine being flexed more or extended more? You can kind of get a sense of your lower back's involvement. And from there, you can decide, well, maybe I need to find a different exercise. Maybe it's not flexing or extending, but something different in the lower back. Or if those don't really do anything here or there, then moving down the chain to your hip and following that same process, making sure no exercise that you're doing is making you feel worse, feeling sharp, should feel like it gets easier to do with more reps, should feel like it's helping one of your baseline tests. And from there, there's a standard kind of process that I might follow where certain hip stretches seem like they help more often for the majority of people than others. But you can really just start with which hip openers or hip exercises you feel are the most effective. Like maybe you intuitively feel really good doing a certain stretch. What you would do is you would do that stretch and then test those baselines, because the trick that some people run into is that there are times when something feels good to the muscle, but maybe it's irritating to the joint, and you don't know until you do those movement baseline tests. And then sometimes an exercise doesn't really feel like it's stretching anything, but maybe it is actually helping some of those underlying movement patterns to feel better. So that's why the movement testing is so important, and kind of taking each exercise as a variable or an input, and then kind of seeing or figuring out how your body responds to each one helps you build a routine or a program that is, one, it's the best fit because you've tested each exercise, and two, it takes you the least amount of time because you know which exercises you should be doing which exercises might actually be working against you that you're doing right now in your routine, and then what exercises are either repetitive or noise, and you can really cut down on the number of things you have to do. And everybody wants to save time, so that's no better
Yeah.
way to do it.
No one wants to do anything we don't have to do. It seems
Right.
just overkill, hey? So let's do the stuff that makes the difference. In terms of how often we have to do that, so maybe twice a day?
So how often kind of depends on how long you get relief for. So it depends on what you're dealing with and how long you get
Okay,
relief for.
yeah.
So if maybe you're not experiencing too much discomfort, but you're just kind of looking to optimize things and just feel nice and relaxed, and that feeling lasts quite a while, maybe you do it once or twice a day. But if you're dealing with more persistent pain, or this pain that's kind of a presence but does release with the exercises, you almost have to figure out what that window is, and then think about it as like you're doing the exercise that helps you open that window where you're feeling better. Ideally, maybe it's one or two of your best exercises. And then throughout the day, the collection of movements, positions, activities, things that your body might not like, kind of starts to slowly close that window, in addition to the non-physical elements of that contribute to pain. And so your job is to keep this window open. So let's say maybe the exercise or stretch gives you relief for 2 to 3 hours. That might mean you do that exercise that's best for you again at the 2 hour mark. And it should only take you, 10 reps, 2 to 3 seconds, or whatever worked best for you. But you may need to do that a little bit more often.
Okay, so I'm assuming that some of my ladies are going to be at work
Yeah.
in an office environment, although a lot of us are now working more from home, which is excellent. It just makes these things a lot easier. But let's say worst case scenario, we're in an office environment and we're not going to be doing Cobra in the toilet.
Yeah.
Would you suggest, I don't know, some kind of version? Let's assume they've got to go to the toilet, but some kind of version of camel where
Yeah.
because you can do that in the toilet, for instance. Yeah.
Yes. So most of the time, yes, you find substitutes or replacements that you can do either sitting or standing to make it easier for work. However, you do still have to test those to make sure you're getting the same response. So although it feels and looks similar, it is a similar way to extend the spine. When you do it standing, it's a little bit more load and stress than it is lying down. So sometimes your body may not accept that in the same way it accepts the lying down version. And
Mhm.
for me, when I dealt with hip issues in the past, my body didn't really care for the Cobra, but for some reason, just standing and bending back was what helped me. So you have to test each one. And it's very important to test each one individually and see, well, can this be a replacement for my Cobra? If so, then perfect. It makes it easier for you to do. If not, then you might have to bring a yoga mat to work.
Fair enough. I guess it's about doing a consultation with yourself to start off with, and then keeping that consultation going as everything starts to open up.
Right. Yeah.
Cool, thank you. Have you got anything else to add?
Um, I don't know if I have anything else to add. Do you think we missed anything? Any questions that you feel you have, kind of hearing all of this, that you think the listener might have?
No, I'm just looking to see. No one's actually asked any questions on here, but we can just keep talking a couple of minutes, see if anyone comes up with any questions they've got to ask us. So I guess while we're doing that, how do people get in touch with you if they're interested?
Well, you can follow me on Instagram at Hip Recalibrator, or you can find me on YouTube. Just created an account, Dr. Malik Parker DPT. I'll be on there posting videos to help you guys
Cool. And you'll have some
and girls.
your videos already
Okay.
where you're doing some examples and stuff. So very good. Right, so we've got no questions, so I think we might be finished.
Well, it sounds good. Great speaking with you, Karen. Thanks